All right, so we're talking about obsessive compulsive disorder today. This used to be considered one of the anxiety disorders, but it has its own classification in the Diagnostic and Statistical Manual now. Um, it's part of the obsessive compulsive related disorders category now. Let me just get the chat screen up. Um, so these are grouped together because of shared features, and they're clearly having a lot in common with anxiety disorders because they used to be considered anxiety disorders, but these have some things in common, and they're kind of specified enough to be considered on their own. So they include OCD, obsessive compulsive disorder, hoarding disorder, body dysmorphic disorder, trichotillomania, and excoriation. Um, so you guys probably know what hoarding disorder is. Can somebody give me an idea?
Kind of like when you're attached to something, you can't like let it go. So you have like something like for 30 years that you never use, like a jacket or something, and you just refuse to like throw it out.
Yeah, and people will not throw out a straw, a receipt, useless things, old cups with old liquid in them, for fear that they're going to need them. So they can't recycle things or throw them away or give them away. And they end up not having enough room in their homes to live in. So they used to do shows like on Oprah. They used to have, she'd send in a cleaning crew and they'd clean everything up, and did that take care of everything? So their house was sparkling clean after Oprah took care of it. So would that fix things for the person?
No, it wouldn't. Because then they're gonna like worry that she got rid of things that they needed.
Right. And what are they going to do right after that? Are they going to stop hoarding?
Keep hoarding stuff,
Yeah.
like start
Yeah.
all over.
Yeah, it just starts right over again because the hoarding, yeah, continue to hoard. It's going to start all over again because the hoarding disorder hasn't been treated. So, yeah, what the symptom has been treated. And I mean, that's important because it's a health issue and it's an issue of neglect and abuse if the person has children or other people who depend on them that are living with them. Um, but so it's part of the problem, but it doesn't take care of that person's tendency to hoard. And what about body dysmorphic disorder? We're going to talk about that more, but can somebody give me a general idea what body dysmorphia is?
Isn't that when you kind of see your body in a way different than what it actually is because of like if you think that you're bigger or smaller than you actually are?
Uh-huh. Yeah, so people have a real or imagined flaw, and it's greatly exaggerated. If it is a real flaw, say, their nose is a little bigger than most noses, or they do have some acne, but it gets um, overly emphasized to the point where they might develop agoraphobia too. There's a huge suicide rate. There's a huge risk of suicide among people with body dysmorphic disorder. So people can kind of tend to think of it as, oh, it's just somebody who's very, very sensitive and very self-conscious, but it's much more than that. It's very close to a delusional disorder. Somebody thinks um, they're not okay to go out. They can't be seen. It's really severe. And then trichotillomania. Can somebody tell me what that is?
When you just keep pulling out your hair.
Uh-huh. And somebody else was saying something?
Oh yeah, I was just gonna say the same exact thing.
Okay. So yeah, somebody pulls out their hair compulsively and can't stop. So in all of these things have one thing, many things in common, but one of them is like that they have intrusive thoughts about these things and they can't stop them, even though they realize that they're not really useful thoughts. And to some degree, they might realize that they're not really based in realistic facts sometimes. But some people with hoarding disorder and some people with body dysmorphia really believe that they're going to need those things and something terrible is going to happen to them if they throw them away, or they really do have a horrific flaw and can't be seen by other people. But so in trichotillomania, people can't stop thinking about pulling out their hair and then doing it. It used to be considered an impulse control disorder because people get an intrusive thought about doing it and then they experience some relief when they do it, but then there's this horrible guilt and remorse after they do it. But it's not always the hair on their head. It can be eyebrows, eyelashes. Some people pull out their pets' hairs. Some people pull hairs from rugs. And they do it from, anywhere on their body that they have hair. And it can cause, permanent damage to their hair so that it won't grow back. So it can be pretty devastating in people. And what about excoriation? What's excoriation disorder?
Skin picking.
Skin picking. So yeah, in skin picking disorder, people might have, some real blemishes, or just imagine them. They might see pores, that you can see, or a tiny, abrasion as a big deal and be unable to not try to smooth it out or pick at it. It's okay. It's okay if you have problems with Wi-Fi. I understand. So they have an inability to stop picking at it, and it will interfere with their functioning because it will get to the extent that they feel like they can't go out because of obvious signs of picking. A lot of people pick their face, and a lot of people pick their feet to the point where they really hurt and it's hard to walk. And these excoriation and trichotillomania are way more common. I don't know, they didn't even used to be in the DSM. I think their excoriation is new to the DSM-5, as is hoarding disorder. So, people didn't even, it wasn't even a disorder, and they're really, really common. People don't admit it, and people don't want to talk about it a lot of the time. They're really embarrassed by it, but it can have pretty devastating effects. So,
Isn't excoriation also called dermatillomania?
I'm sorry, what?
Isn't excoriation, I've also heard it called dermatillomania, so it's basically.
Yep, people call it skin picking disorder, dermatillomania, because it's kind of like pulling your dermis off, kind of like trichotillomania is pulling your hair off your body.
There's a YouTuber that talks about having dermatillomania, so that's.
She might be from, I used to show Girls on the Pole, and I think they're all from the UK, and it's it's like about stories about 4 women who have pretty severe trichotillomania, and they deal with it in different ways with like different hair pieces. And there's a woman who actually has like a hair replacement business for people who do that, and it's actually part of the treatment because they cover the part of the scalp that people tend to pick at, and it gives time, and it's a semi-permanent thing on their scalp, and it gives time to see if the hair will grow back while they get treatment. Yeah, so, but I just cover so many disorders that I don't have a lot of time to show that. But yeah, isn't it fascinating?
I have a
think it's
question.
Huh?
I have a question.
Yes.
So, like the people who are like couponers and like they buy like tons of like food that are on sale, would that be like a hoarding disorder? Because they have like a whole store of food in their house?
No, because they could have some kind of obsessive compulsive personality disorder, maybe. But doing that, they're not collecting totally useless things, and they don't have difficulty parting with, like, a dirty baggie. You know what I mean? You guys don't know what a baggie is, a dirty Ziploc bag, or old food, or and it usually doesn't get to the extent that they can't use their living quarters because of it. I mean, it can get a little over the top with the couponers, right? But it's more like a personality quirk. It wouldn't reach the level of a disorder unless it was causing significant distress or really interfering with their daily functioning or their relationships. So it'd have to be kind of more pervasive than just being an over the top annoying couponer, and there are a ton of preppers, right? Who it's like an all consuming, kind of hobby almost. Um, so, but it often doesn't reach the level of a disorder. Right? Okay. Yeah, so those are all really interesting, and they all tend to be, um, different manifestations of just a similar underlying tendency to have an anxiety disorder. And people just don't know which way the anxiety is going to manifest itself, right? One that is very, very common, and I know this because almost every semester a student comes to me and tells me that um, they've pulled all their eyebrows out. That's a really common one. Um, and I had friends in graduate school, male and female, who had pulled all their eyebrows out due to stress. Um, there are so many eyebrow replacement things today that it might be less of an issue than it was in the 90s when I was in graduate school. But yeah, that's a really, really common thing that people with trichotillomania do. All right, so today we're going to talk about, it's interesting, there's this whole category, obsessive compulsive and related disorders, and obsessive compulsive disorder is just one of those, has the kind of the same name as the category it's in. And an interesting thing about the disorder is that you can have the obsessions and the compulsions, or you could just have one or the other. You don't have to have both to have the disorder. People sometimes only have one or the other. So the obsessions are the intrusive, nonsensical thoughts that people have. They can be images, like a really common one. Can somebody think of a common image that somebody with OCD might have that would be really disturbing?
Like a dirty room.
A dirty room? Yeah. So one of the most frequent obsessions that and intrusive thoughts that people with OCD have is almost like a contamination phobia, that they're going to get really sick from germs. And so a really common image they'll have is of something being, overrun by germs, and they'll have images of the germs, entering their skin, and it'll be really disturbing for them. But there are a lot of really nonsensical things that will just run through someone's mind, and they'll just get focused on them. And then that becomes the thing that they picture. That becomes the image that they can't get out of their heads, right? So most people might have a really weird thought from time to, well, everyone, I believe, has a really weird, disturbing thought or image once in a while, or urge that's unexplainable, that has nothing to do with their personalities, and that they'd never want to admit to somebody they actually had, right? And most people just go, that was a weird thought, Amy. Let's not have that one again, weirdo. And then they move on, right? Like, okay, and then move on, right? And you go, you repress it and you just go, we'll never speak or think of that thought that you had ever again, right? You just kind of almost unconsciously do that because everybody has weird thoughts, right? So, like, for example, one of the people that I treated, well, if you consider it treatment, because I was a grad student in like my second year of graduate school, and it was in the University Health Service. So this guy was a sophomore in college, and he had a brother who had a baby, and he was really excited to see the baby, and he volunteered to go and take care of the baby so his brother and wife could go out and get some food and take a break. And he was over there taking care of his nephew, and he changed his nephew's diaper, and he just like thought for a second, what if I touched his penis? Okay, like, what if I touched the baby's penis? Okay, weird thought. Most people would go like, unless you had to clean it, most people would just go, ew, and 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 it's a fraction of a second image or impulse or thought that goes through people's heads sometimes, and it gets immediately wiped from memory, right? Because that's how defense mechanisms are our friends, right? Things like denial, repression, right? That's how we get through life. Because if we examined every bizarre thought we had, we would end up probably with OCD. So he came in because he could not shake being worried about that thought. And he would say, am I a pedophile? Is it safe for me to be near my nephew? Can I be an uncle to my nephew anymore since I had that thought? Am I going to hurt people? Am I going to sexually assault people? I mean, he was just mortified, right? And, I really don't think that he was a threat to small children or to anyone. I mean, somebody got mad at me a couple of years ago because I said I knew for sure he wasn't going to assault anyone sexually. And she said, you don't know for sure. And so, yeah, I don't know for sure. But if I had to bet, everything I own on it, I'd say this person was not going to ever sexually assault anyone, right? But he could not get it out of his head. Now, as far as I know, he didn't develop any compulsions, right? So compulsions are usually a way to deal with those intrusive thoughts, right? So some people have ways that they kind of say, if I do this, this, and this, then that terrible thing won't happen. I can neutralize that thought, right? I can make it so that thought won't impact my behavior so that I'll never hurt somebody, right? And for some people, that's being really clean, and for some people, that's, reciting something, a prayer, a nursery rhyme, counting, right? It can be mental, right? It doesn't have to be something that people can see, right? But it turns into a ritual, and it turns into a ritual that somebody kind of doesn't have a choice whether to act out or not. And then is sometimes people have rituals that don't seem to be connected to any conscious obsession. So the rituals are the compulsions and the obsessions are the intrusive thoughts. But some people with OCD only have one or the other. So my client only had the obsession. He could not stop worrying about why he had that thought about his nephew, right? But some people only have the compulsions, like counting cars, right? Has anybody seen Your Honor? The series with the guy from Breaking Bad in it? Okay, because he's a judge and he runs and he sprints at the end of his run. And the number of cars he passes that are parked before a car is driving down the road and passes him is the number of years that his son will live a healthy life. So he tries to like sprint really fast by like 80 cars so that his son lives a long and healthy life. So people do things like this. It's magical thinking. That's called magical thinking. So there are some things that a lot of people do that like the whole culture does that we think are silly, but people just do them, right? Like superstitions. Can somebody give me an example of one?
Not walking under a ladder.
Yeah, right. Because what's going to happen if you walk under a ladder?
Bad luck. Is that what happens?
Yeah, it's just bad luck. What are some other things that are bad luck?
Isn't like step on a crack and you can break your back,
You can break your mother's back. Right?
mother's back.
Yeah. Anything else?
Someone messaged in the chat.
Oh, sorry. Yeah, opening an umbrella inside. Yep, black cats. That's why they're the last to get rescued. Black cats. And black cats are awesome. Breaking a mirror is 7 years of bad luck.
Isn't there something with salt too? Like if you
Yeah, if you spill salt, you're supposed to throw it over your left shoulder. So you don't, I think it's your left. I can never remember. Throw it over both shoulders just to be safe. Using the number 13. Yep. And if you say something terrible, if you mention something terrible, that could happen. What are you supposed to do?
Knock on wood.
Knock on wood, right? So, and it's funny, there's songs about these things. There's a song called Knock on Wood. These are before your time. There's Stevie Wonder song, Superstitious, and he mentions a lot of these things. And, so nobody would think that you had OCD if you did this once in a while, right? Because remember those things that make things a disorder or not? One of them is cultural deviance, right? And this is part of our culture. Of course, if you were really obsessional about it, like if you couldn't make it to work because, you had to, if you couldn't make it to school or work because there were too many cracks in the road, then it might be a disorder, right? Okay. I have, does anybody know Neil Hilborn's poetry? Anybody familiar with it? Because he's got a really good, Friday the 13th, yeah, or the number 13 and Friday the 13th are both supposed to be very unlucky. So this is Neil Hilborn. He's a really good poet, and he's reciting this poem that is about how his relationship deteriorated because of his OCD. So I think I have to stop share and then share again to share. Okay, so you see the button poetry video? Okay.
The first time I saw her, everything in my head went quiet. All the ticks, all the constantly refreshing images just disappeared. When you have obsessive compulsive disorder, you don't really get quiet moments. Even in bed, I'm thinking, they're locked door yet, watch hands yet, locked door yet, watch hands yet. When I saw her, the only thing I could think about was the hairpin curve of her lips, or the eyelash on her cheek, the eyelash on her cheek, the eyelash on her cheek. I knew I had to talk to her. I asked her about 6 times in 30 seconds. She said yes after the third one, but none of them felt right, so I had to keep going. On our first date, I spent more time organizing my meal by color than I did eating or fucking talking to her. But she loved it. She loved that I had to kiss her goodbye 16 times or 24 times if it was Wednesday. She loved it took me forever to walk home because there are lots of cracks on our sidewalk. When we moved in together, she said she felt safe, like no one would ever rob us because I definitely locked the door 18 times. I'd always look at her mouth when she talked, when she talked, when she talked, when she talked, when she talked. When she said she loved me, her mouth would curl up at the edges. At night, she'd lay in bed and watch me turn all the lights off, and on and 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 off. She'd close her eyes and imagine the days and nights were just passing in front of her. Some mornings, I start kissing her goodbye, but she'd just leave because I was making her late for work. When I stopped at a crack in the sidewalk, she just kept walking. When she said she loved me, her mouth was a straight line. She told me I was taking up too much of her time. Last week, she started sleeping at her mother's place. She told me that she shouldn't have let me get so attached to her, that this whole thing was a mistake. But how can it be a mistake that I don't have to wash my hands after I touch her? Love, it's not a mistake. I just can't. I can't go out and find someone new because I always think of her. Usually, when I obsess over things, I see germs sneaking into my skin. I see myself crushed by an endless possession of cards, and she was the first beautiful thing I ever got stuck on. I want to wake up every morning thinking about the way she holds her steering wheel, how she turns shower knobs like she's opening a safe, how she blows out candles, 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 blows out. Now, I just think about who else is kissing her. I can't breathe because he only kisses her once. He doesn't care if it's perfect. I want him back so bad. I leave the door unlocked. I leave the lights on.
Oops. Okay, so what were some of the symptoms of OCD that he talked about, and what are some of your impressions of his poem?
When he would go on dates with her, he'd have to like organize his food by color and then like chew it like a certain amount of times.
Right, and that's called, when you have to organize it, well, it's related to a need for symmetry. So people with the disorder might need to, straighten pictures that are on the wall. I mean, I have to do that, and I don't have the disorder. By the way, it's not great to, when you're doing that, say, oh, I'm so OCD. That can be, it's like hurtful to people who actually have the disorder, because it is one of the most severe, if not the most severe, anxiety disorders. So it upsets people who have it to have people joke about it as though it just means you are really clean and tidy, right? But the need for symmetry is for things to have to be lined up perfectly and, the same weight on each side and that kind of thing. But some people have, obviously a lot of people have that without having the disorder. Any other examples of symptoms?
He talked about like, he talked about like excessive hand washing.
Mm-hmm.
He also talked about at the beginning, he had tics, and then when he met her, they stopped.
Mm-hmm. What were some of the obsessive images and thoughts he had?
Did you talk about getting robbed? So when he like locked the car 18 times.
Mm-hmm. Yeah, he would lock the apartment, and yeah, so a fear of getting robbed. What was the image he had that was disturbing? I talked about it earlier too. He actually had a couple. One was germs getting into his skin, and the other one was an endless succession of what? Remember? Cars crushing him, right? So all these little rituals he's doing it are to kind of say, if I do these things right, these terrible things won't happen, right? So what were some of the things that she became impatient with?
I think one of them was when he would like step on a crack. He would stop and she would just keep going.
Hmm.
Wasn't one when he could kiss her goodbye or something, she would always have to leave because he did it too many times?
Yeah, he had to kiss her like 16 times or something to make sure the kiss was just right. And that's one thing that's really distressing him about thinking about her with someone else, is that it would be someone who would just kiss her once and not care if it was absolutely perfect, right? So what were some of the good thoughts and images that helped, take up some of his mind when he was in a good relationship?
He always kind of said that he constantly had things like going on in his head, but then when he like saw her or was with her, he kind of just like focused on her.
Hmm. So what were some of the things, like details that he would, oh yeah, oh sorry, people are chatting. Yeah, he would turn the lights on and off. That's really common. So checking is a type of compulsive ritual that a lot of people do. Checking to make sure the iron is turned off, the stove is off, the lights are off. And people will turn them on and off a certain number of times to make sure they're off, even though you could just do it once, right? They'll go on, off, on, off, on, off, on, off a very specific number of times, right? Yeah, so his mind was more quiet, but even when it was, spinning like quickly, it was now about something good. So instead of picturing, being crushed by an endless succession of cars, he was picturing, her hand turning the shower dial like she was opening a safe, right? The way she blows out candles, right? So how did his behavior, not just his words, demonstrate some compulsions? He didn't look like just any person reciting poetry, right? There were some things a little different about him. What did he do differently?
You can see like the emotion he puts into it, or like some tics he has. Like he kept like grabbing his head at the end when he was getting frustrated. So
Uh-huh.
maybe that's a way of coping. Like some people pick at their skin or something. So he
Right.
can, like fidget with his hands or like grab his head.
Mm-hmm. Yep. Oh, somebody's asking, would having to do something a certain amount of times be a compulsion or an obsession? It's a compulsion to deal with an obsession. So the compulsion is needing to do something or recite something or count something because of anxiety and worries about something. And those are the obsessions. So the worry is, oh my God, I'm going to leave the lights on, and that gets blown out of proportion. So they end up doing the compulsion to deal with all their anxiety. Yeah, and somebody's saying he said certain words multiple times, right? Remember, he said blows out candles, blows out candles. He said it many times. Now, do you think that might be a symptom, right? Like the same way he has to kiss her multiple times, right? To make sure it's just right. Maybe he has to recite phrases of the poem until he feels he's got the intonation just right. And then it seems like when he grabs his head or stomps his foot, he's like, I gotta stop, that one was good enough, right? He's trying to stop himself from going on and on. Oh yeah, and he sprinted away at the end instead of standing there waiting for the audience's reaction. Yeah. I mean, he bared his soul, right? And he's got a serious anxiety disorder, so it'd be tough to deal with the reaction, although obviously they loved it, right? They're applauding at certain lines, right?
I don't know if this is one, but I noticed like certain like lines of the poem he would say louder than others.
Uh-huh. Yeah, it might be because of how, yeah, it was like his frustration, things that he was particularly frustrated with, or when he was trying to be funny. Because remember he said, when you have obsessive compulsive disorder, you don't get a lot of time to, relax or something like that. He got really loud when he said that, didn't he? I don't know, maybe he, things that he thought were particularly good or points that he really wanted to make, he did get really loud. Okay. Anything else about the poem? Okay. Yeah, he did speak very fast sometimes. Right? Yeah, I think that's definitely a symptom of anxiety, right? Getting it over with. I mean, it's the number one issue in class presentations, right? If you've seen, if you've gone through classes where there's a series of student presentations, like the number one thing everyone's thinking when someone presents is slow down, right? I can't hear what you're saying, right? Well, don't read and slow down, right? Isn't that what everybody's thinking? And I say, can you slow down? I tell people, but yeah, that's what happened. Everything speeds up when people are nervous. All right. Let me go back to PowerPoint. Can see it? Okay, excellent. All right, so these are the DSM criteria. So again, it can be obsessions or compulsions or both. Like my client only had obsessions. Neil Hilborn has plenty of both, right? The poet, he has plenty of both. So the obsessions are recurrent, intrusive, meaning they come in, he doesn't get to pick when he has these thoughts. They can be urges, to do something over and over again, or images like germs coming in, getting crushed by a car, and they're intrusive, inappropriate, and they cause distress. And they're not the same thoughts that everybody has, everybody gets distressed by, or tons of people get distressed by public speaking. Lots of people have nightmares. They show up somewhere naked. A lot of people are afraid of dogs, but this is stuff that is most people would consider, a lot of people would consider over the top, out of proportion. So people try to stop thinking that way, but they can't. And they'll often end up having compulsions to try to deal with, like to suppress those thoughts so they can calm down. So the compulsions can be mental or physical acts, like counting, reciting things to oneself. And the person just feels kind of an unrelenting need to keep doing the thing, even though it annoys them, it keeps them from doing what they need to do, right? And by the way, there's a duration element to this. Does anybody know? Does it say on here? There's a certain amount of time a day it's supposed to take up, at least. How much time a day should the thinking or doing rituals take at least?
Is it 1 hour?
Yeah, it's 1 hour, and it used to be more, I think, in the last DSM, and I'm kind of, it worries me a little. So spending more than 1 hour, ordering, putting things in very specific order, or, reciting something. Of course, we're not gonna diagnose very religious people like nuns. We're not gonna diagnose them with OCD for praying a lot, right? But counting cars, things like that, if they're spending more than an hour doing that and it gets in the way of them, getting to work on time, getting to school on time, that's a problem, right? And they're doing it to reduce anxiety or prevent some dreaded outcome. And they're usually not connected in a realistic way to what they're trying to prevent, or they're clearly excessive, right? So, if you worry about, your safety, you probably lock the doors, right? And check the windows like once, maybe twice, right? But if somebody's checking them 15 times, that's excessive, right? They might have PTSD, that's another disorder. There's all kinds of rule outs and, differential diagnoses that need to be done too. But yeah, it's usually something, like not stepping on cracks isn't going to make it so cars definitely won't crush you. You know what I mean? So they're not connected. And sometimes the people are like know that and still do it. So they have to take more than an hour a day or cause significant distress or impairment. So sometimes someone who's trying to recover from, doing something that's not useful, like say their hands are already kind of destroyed from overwashing them, and they spend less than an hour washing them with hand sanitizer, but it destroys the skin and it reopens all the wounds, that's going to cause significant impairment, right? So it doesn't always have to be an hour or more. And it can't be due to the effects of a substance or another medical condition, and it can't be better explained by another disorder. So criterion C here, you're going to see over and over again, you already have, right? You can just like kind of memorize that. It's not due to the direct physiological effects of a substance or a medical condition, and it's not better explained by the symptoms of another mental disorder, right? Because if it's trichotillomania, they're gonna have all these symptoms, like the intrusive thought is, I want to pull out my hair, don't pull out my hair. What if I pull out my hair? And then the compulsion is to pull out the hair, right? So it's very similar symptoms, but because it's so circumscribed to hair and it's a common thing and it has really particular outcomes associated with it, it has its own diagnosis, right? And body dysmorphia is very similar to anorexia, right? But anorexia has other symptoms that are so distinct, and it's a common disorder on its own, separate from body dysmorphia. So it has its own diagnosis, right? So you just figure out what's the best answer. It's kind of like when you're taking a multiple choice exam and your mean professor gives you 2 answers that are okay, but one's better, right? It's like that. It affects more people than you would think. 2% of the population is kind of a lot. And just so you know, have I told you guys what the statistics tend to be for most of the disorders that we go over this semester? Well, do you guys remember what kind of treatment tends to work for everything we go over this semester?
Cognitive behavioral.
Cognitive behavioral therapy. And what kind of medicine?
Benzodiazepines.
That's good for anxiety. But what works for like everything?
Oh, SSRIs.
SSRIs, right? So SSRIs and CBT, guess what? That works for OCD. And it's exposure. For all the anxiety disorders, it's exposure, which is a type of CBT. And then in terms of statistics, the prevalence for most of the disorders that we talk about this semester is going to be between 1% and 3%. Okay, but we've been talking about anxiety, which is more common than the other disorders. So a lot of these have been over 1% to 3%, but OCD is the most severe. So it's a little lower than the other anxiety disorders. But if you have to guess, if you have no clue, and I say, what's the prevalence of X? Just be like 1% to 3%, and chances are you'll be right. If I say, what's the treatment for X? Say CBT, and chances are you'll be right. What's a good drug for X? SSRIs? You know, you're going to be right most of the time. And doctors give out SSRIs like candy, basically, right now. Something like 1 in 4 women in my age group are taking SSRIs in the United States right now. Yeah. Okay, so onset, early adolescence or young adulthood. So around your age, back to middle school. And it tends to be chronic. It's tough to treat. People tend, have times where they get better, and then a stressful event might make it worse, right? Like I bet quarantine makes it worse for people, something, especially for, oh my goodness, people with contamination fears, it's gotta be really rough for people with germ phobia, right? Let's see. It's parallel to other anxiety disorders. There can be early life experiences that can affect it. There can be, people can teach their kids that some thoughts are unacceptable or dangerous. And I think it's always a really good idea to tell children that, there's every kind of thought out there. You'll experience every kind of thought during your life. It's what you do with that thought, And I tell my kids, anxiety is a big liar. Don't believe it. The stuff that anxiety tells you you're going to do and other people are going to do and the world's going to do, anxiety is full of shit. Don't listen to it. It's not the content of the thing, it's that, like, just don't listen to it. I mean, you can't just not listen to it. I don't just completely blow it off, but I try to let them know that it's not based in anything. Just because you're having a thought doesn't mean that it's an important one or it comes from somewhere meaningful. This is, sometimes your brain just misfires and it doesn't mean anything. Think about dreams. Not all of them mean something. And I like to try to tell people that thoughts are not the same as actions. And people with OCD kind of think that thinking something is just as bad as doing it, and thinking that you'd like to punch somebody in the face has nothing on actually punching someone in the face, right? I mean, it's a lot worse to actually physically hurt someone than it is to, fantasize about it for a few minutes. All right, so I'm over by a minute. I apologize. And I'll see you guys on Wednesday, okay?
Thank you.
Take care.
Thank you.
Thanks.
Thank you.
Thanks.